Hello, everyone. My desire is to give you a few details about the procedure that I had today. It's called the pH impedance Digitrapper. This actually is used to determine the amount of pH level that I have in my stomach, also to determine if my esophagus is not working properly. So just to kind of backtrack, I actually about a year ago started having issues with acid reflux. And I have been singing all my life, but there was started having problems with my throat, sore throats, and a little coughing, and certain foods would cause me to um, just start having burning and acid heartburn is what they call it. So over a period of months, it started to get worse. I would get hoarse, and it would wake me up at night. And so the acid reflux started to actually change my life. It started changing the way that I would eat. It affected my sleeping. And so I would go to the doctor, and they would just say, oh, that's just acid reflux. Okay. So take some Tums, take omeprazole, I believe is the name of the medication, every morning. Eat certain foods, stay away from certain foods. Um, about 3 or 4 hours before I go to bed, don't eat anything. So I would do all of these different things, doing a lot of research, trying to understand what I need to do to change my uh, routine so that I can get rid of this acid reflux. But lo and behold, it began to get worse and worse. It came to a point to where I really couldn't eat anything without having some type of heartburn or having, um, being awakened at night, just coughing for, 30 minutes to an hour. And then it started to affect me from a breathing capacity. I started having problems breathing. It started bringing on asthma. And I'm just like, what is all of this? And wheezing. And so, to make a long story short, a year and a half later, now I have a nebulizer that I use 3 times a day, um, because all of a sudden now I have asthma issues. With the acid reflux, it's actually um, gotten worse, so now it's considered gerd. And what that basically means is chronic. The coughing, certain foods I can't eat, um, feeling like I have a lump in my throat. Just it's just really, really has changed my life. And I'm the type of person, I'm always busy, always on the go. And so this is really taking a turn on my life. But I'm always positive, always wanting to look at the bright side of things. It could always be worse. So what you're seeing right now is the result of a pH um, monitor that I'm using right now. And what this is doing is that it's actually a device that I'm wearing for 24 hours. I had an appointment today at 9:45 with the GI doctor, the GI clinic at my local hospital. And so what they're actually trying to do is determine what is the level of pH in my stomach, the acid in my stomach. We all have acid in our stomach, but mine is to the point to where it starts to almost regurgitate, and I can literally feel the acid just shooting up in my throat. And it's a burning sensation. It causes me to gag, causes me to cough. And this is pretty much on a daily basis. And that's actually affecting my esophagus. So my esophagus is working overtime. I don't know if it's damaged my esophagus. I've already had the EGD where they did a scope to look down my throat and my stomach, and no hernia, no hernia was located. Everything looks fine, but this is just taking it to an extra level, another level. So actually what happened today is that due to the recommendation of a doctor, he said, well, did you do a pH monitor? That was about a month ago. And I'm like, well, I've been going through this for a whole year and a half. Why didn't they refer me to this sooner? But nonetheless, I'm excited that I was able to do it. So just to give you a little bit of history with this, my appointment was 9:45. I checked in to the clinic. They did my vitals, my weight, and my blood pressure, temperature. I sat down for about 30 minutes. They kept checking on me just to see if I'm okay. Um, Came back, just, do you know what you're here for today? Just to make sure I understand what I'm doing. Me being the type of person I am, I looked at many, many videos about the Digitrapper or pH monitor to just get an idea of what this is about. I knew it was going to entail having a tube in my nose. I knew that. But it is, to me, in my opinion, is the videos that I saw, it was not close to what I experienced. The this procedure is well needed. I know that sometimes in order to get healed, you have to get hurt. So I understand that. But it is not to try to scare anyone, but it's a lot worse than what I thought. But I'm a tough person. Been in the military, have had 3 children, been married 30 years. So I'm a tough person. But just to kind of mention, after I was seated for about 30 minutes, then the doctor came over, discussed it with me again. I signed off. You know, everything has risk involved. I said, okay, I'll sign the paperwork. So they took me to a back room. And so on the table, there were 2 different tubes. One tube was about the width of maybe a straw, or maybe a slightly thinner. And the other tube was about the size, about the size of a spaghetti string. So basically what happened is that she had a syringe and she squirted. She asked me what nose or what nostril I want to use. So I said, well, okay, use the right, because I have sinus issues, which is another situation I think that has come about due to this acid reflux. So she squirted some thick, gooey stuff in my right nostril, and she told me to suck it up, you know, basically suck it up. So I press my left side to suck it up. You know, it's like I'm trying to inhale it to get it to go down through my nostril in the back of my throat, which is what you want to do because it actually numb the area. Not numb it, but it takes away the edge. So that's set for about 5 minutes. So this is when it gets interesting. So this little tube, I would say about the size of a straw, she began to push it. I want to say it's about 2 feet long. It may not be that long, but she started to push it up my, excuse me, the nose is running a little bit. Push it up my nostril. And as she pushed it up my nostril, it is probably the most uncomfortable thing that I ever experienced in my life. It was so uncomfortable to where my eyes were watering, my nose were watering, and I'm just leaning back. The more she pushed, the more I leaned back. But at the end of the day, I knew that I had to take care of this. This is something I had been wanting and needing for a long time. So what I decided to do is to go ahead and let her finish what she needed to do. And what ended up happening is as she began to push that down my throat, it started to get stuck. Started to get a little stuck, and she would pull it out and push it back down, push it back down. And you could feel it going through your nose, down the back of your throat. You could feel it. It felt like a lump. And she would just push it down. So at this point, you have to be very, very strong. It's more of a mind thing. You have to really just say, okay, I'm going to get through this. I'm going to get through this. You have to really talk to yourself mentally. Say, I'm going to get through this. So when she did that part, there were readings on her little computer that would let her know when it was inserted far enough. So the next step is that she said that there were 12 different drops that she had to put in my mouth. Now, by this time, she told me to do an incline. So instead of me sitting up, I was, I leaned back in the bed, and it was like kind of like at an angle. And she wanted to put drops in my mouth. And she said, swallow, but don't swallow once, but don't swallow again for 30 seconds. That was the most difficult part. And as you can see, I'm wheezing right now. All of this is coming from the acid reflux. She said, swallow once. One swallow, not two. And don't swallow again. So literally, you swallow once, and you have to hold it like this. It's almost like holding your breath. Because even if your mouth is full of saliva, you can't swallow for 30 seconds. And that's very, very hard to do when you have a tube up your nose and you have this saliva that's building up, but you can't. So she did that for 12 or 13 times. So if I swallowed, then we had to start over. And so it was 12 or 13 times. And that was very challenging. But after the first 2 or 3 times, I kind of got the hang of it. It's another, it's another mental situation where you just have to say, I'm just going to push myself. I'm just going to do this. Because it's no turning back. You want to try to push yourself. I know it's uncomfortable. It makes you want to just say, oh my gosh, I want to go home. But you got to push through it. You got to push through it. And so I did that. And she was cheering me on the whole time. Very nice young lady. Then the next step is she said we were going to do some rapid swallow. So this whole process was to read how I swallow on their computer. So I would do that and do that. After about 3 or 4 times, I was like, okay, I can't swallow. So literally, she would put the drops in my mouth, say swallow, don't swallow for 30 seconds. So that process took probably about a good, I don't know, 10, 15 minutes. Then she said, okay, let's do a rapid swallow. So then she put drops in my mouth again, swallow, drops in my mouth, swallow, drops in my mouth, swallow, drops in my mouth, swallow. So it was very unusual to have that type of, excuse me, I have to dab here. Very unusual to have those kind of instructions. So you learn something new every day. So that was the first tube. Then she said, okay, we're all done. Then she pulled that tube out, meaning I had to take a deep breath. And then she just pulled it out. And all this gunk was just kind of like, not to be gross, but it was in my nose. So I got some tissue and just began to blow my nose and get all of that solution out. And I'm just like, oh my gosh, I have never in my life experienced anything like this. So that's part one. Part two is this little thing here. Now this is tiny compared to the other one. So what she started to do is use this same nostril to push this in. She tried to do it on the right side. And she was trying to put it through, It was like it was stuck. It was stuck. It wouldn't go through. And because of this GERD, it's brought on sinus problems as well as asthma symptoms. I believe my sinuses are inflamed. So I mentioned to her, let's just stop. So I said, let's do the other nostril. So she got the syringe again, pushed, and she just sprayed the little stuff up my nostril. We waited about 5 minutes. Then she put this second tube up my nose. And it was going, then it started to get stuck. So she said it was getting stuck in this area here, which is, again, very uncomfortable, but not as uncomfortable as the first time. And again, this is the part where you have to really, really be strong mentally, because if not, you will say, the heck with this, I'm going home. But you have to be very, very strong mentally. By this time, my eyes are watering, my nose are watering. And she's just saying, you're doing good. She's rooting me on. So I remember watching a video where someone was sipping some water, because by this time my throat is it's not producing enough saliva to swallow. I don't know if that makes sense. So I asked her, can I sip some water? So she had a cup of water with a straw. So when I sipped it 3 or 4 times, it just eased down. And she could read on her um, computer screen that it was in my stomach. So, with that being said, the next thing she did was she taped this to my face here. She wrapped this around my ear and she taped this here. So now I have this monitor. And the way that this monitor works is that there's a setting for you press a button before you eat, you press a button after you eat, you press a button before you take a medication, you press a button if you have any coughing or wheezing or belching, and you press a button to alert it that you're going to bed. So this is it's a little uncomfortable. It feels like something is pinching my nose, and as you can see, my nose keep running because I've been blowing my nose. But all in all, on a scale of 1 to 10, pain, 1 being uh, low pain, 10 being high, I would say it's probably not even a 1, but it's just uncomfortable and it's hard and it feels like pinching. So my next appointment is tomorrow, in which they will uh, remove this, and in 2 weeks I will have to go back for my results. So another thing I want to mention, let me